We have the former Auditor General, Professor Edward Duajima, here, and we'll take a question from him. It's on.
Thank you, Mr. Greenstreet. During your presentation, I didn't hear you talk about corruption, even though you made mention of it during your answer to the first question. And I'm interested in fighting corruption. The current requirement that public office holders should declare their assets has not been able to work effectively as a means of fighting corruption in Ghana. What will your government do to improve the system so that assets declaration will be one of the potent machinery for fighting corruption in Ghana?
Thank you very much.
Thank you for the question, sir. And I would like just to make a minor correction. I did actually refer to corruption in my presentation. When I was talking about civil and public service reforms, I talked about the issue of bribe taking and how I would wish to tackle that as part of our overall anti-corruption efforts. But you're right, and I accept that it is a problem that we are having with public office holders and declaration of assets. And sometimes with these things, the greatest way to try and push the system further forward and make things more transparent is to expose those who have flouted the law in those areas. And I think that if we're able to do that, then the laws which exist can be implemented, because we believe in strict law enforcement and applying the penalties. But as at now, the laws exist in this particular area, as you have rightly said, but they are not being enforced. So it is human beings who enforce the laws. So as politicians and as members of government, we have to come together to make sure the laws are properly implemented for the very problem that you have identified to be properly rectified.
Thank you very much. We will now take a question from the Executive Director of the Ghana Integrity Initiative, Mrs. Linda Oforikwafu. She is not here yet, so we will move to...
Thank God for that.
We'll move to an expert in health policy systems, Dr. Aku Kwame, to ask her question.
Thank you very much. Good evening, sir. I very much enjoyed your presentation this evening. You alluded to the importance of evidence in your comments, and we've come to appreciate the need for evidence in planning, data, information, and research in order to inform our policies, programs, and plans in our nation. Recently, there have been rumblings to revisit the need for a national health research fund, which can then drive the priorities of a national health research agenda. And previous studies have also shown that the power and utility of such an approach can actually leverage our donor partners' funds towards our priorities, which have been homegrown identified, as opposed to our priorities being driven by our donor partners. My question is, what is the CPP's position on establishing a national health research fund, and where could monies for such a fund come from? Thank you very much.
Thank you very much.
Madam, it's a very important question. Fortunately for me, the chairman and leader of my party, Professor Dr. Edmund Dilly, has been a doctor for 45 years. And I remember him coming to the office one day and us having a discussion at the CPP headquarters about this very same issue, the setting up of this research fund. Because for us, research is key in all of the areas of activities that we want to engage in. In fact, it is my intention, if elected president or when elected president, to ensure that just in the same way we have a national security coordinator who is supposed to be an expert in these security issues, I would wish to ensure that we have appointed a national coordinator on scientific matters to be able to properly advise government and the presidency as to how to move forward, because they are very, very complex areas. And research is key, both in terms of the kinds of plans that we are proposing, but in so many of the things as a nation that we have been trying to do, especially in other areas of technology. And during that discussion, in fact, he was in favor of the establishment of this fund. And I have to say, I was the one who was a bit lukewarm, and I was saying to him, well, Prof, where are we going to find the money from? Precisely what it is that you have just alluded to or referred to. And so I think there are some creative areas that we could look and search out with those in the financial sector as to what kind of minor taxes we could place in some, specific areas. I certainly would not be opposed to a minor tax on tobacco or plastics to fund, a fund of this nature. But there are many creative areas that we could look at, and I believe the discussion is underway. And I think it's not more about whether we should have it anymore. I think everybody has now agreed that the fund is critical and important, but how we go about finding the funds is something very important. And I think it's an area we would certainly engage in very aggressively. And as you know, one of our leading members, Professor Ajiman Bedu-Akosa, also has some very strong views on the health area too.
Just a quick follow-up. I noticed you said minor tax on tobacco and other things, plastics. There is a complaint among the public that this government is overtaxing Ghanaians.
Yes, I agree.
Are there any specific areas that if you are elected president, you would directly cut taxes?
Well, I see that Bernard has brought the second blow. Well, I think certainly, as I indicated in my presentation, corporate taxes have to be reduced. Because as at now, I think a survey that I saw over a month ago stated that the businesses, before they even file their taxes, are paying something like 22 or 23 different types of taxes. And I think that is really too much of a burden on the ordinary, overburdened private sector. But in terms of areas of specifics, I certainly would not, as was recently done by the NDC and the MPP, reduce the taxes and royalties I get from gold fields or gold companies. I cannot understand how those two parties in Parliament took that decision to reduce taxes on Goldfields Ghana for the royalty and taxes they pay to the nation state. We would want more from our national resources because we have got nothing from gold over the years. So I might find some areas where corporate taxes to be reduced, but I'll increase it in some other areas. And in fact, if you'll allow me to go further, since I was not able to talk too much about the extractive sector in my submissions, I think we would even, you see, the problem with royalties and taxes in that extractive sector is that you don't earn much from royalties and taxes. Where you earn the most is from dividends. If Kutu Achampong hadn't insisted that we had 51% of Ashanti goldfields, former President Rawlings wouldn't have had 51% to go and sell for $300 million. Botswana today owns, the state owns 51% of its mining enterprises. 51%. And we sit here trying to grab little bits of crumbs from all of these areas, whilst we have these resources in our soil. How many years are we going to allow this to continue for? I'm sorry, Bernard, you see, you gave me a chance to slip into politics again. So I'm happy
to go back to the extractives. Thank you. So let's bring in now the Executive Director of the African Center for Energy Policy, Dr. Mohamed Amin Adam.
Thank you, Bernard. And let me also congratulate you for that inspirational address. As you know, and many Ghanaians know, we do not have enough electricity. We have a shortage of about 300 megawatts today. And this is this time not attributed to lack of generation capacity. It is due to lack of fuel. This was a question I asked Dr. Edward Mahama, and I want to know what your response to this question would be. And so, to this effect, Water levels in Akosombo are low. Gas from Nigeria is not coming because we're owing them. Many of our plants are shut because of lack of fuel. There is so much gas stranded at Atuabu, yet plants in Tema are shut down for lack of gas. Given that fuel is so critical, the most important challenge in our power sector today, how will you address the problem of fuel insecurity if you are given the mandate to govern our country?
Thank you very much.
Thank you very much, Anta. And I would like to say that Anta is somebody who I've observed over a number of years, and I really appreciate your knowledge and contribution that you have made to the energy sector over the years. In actual fact, when the CPP comes into government, there are certain key ministries and areas where we will look very, very, very carefully before we decide who will be appointed there. Because we have to have some real islands where there's no corruption and high levels of professionals. Because if we don't do that, those areas will continue to have all the kinds of problems that we're facing today. And energy is one of those sectors. And I know, inshallah, that as I approach the Flagstaff House, I'll have a conversation with my chairman and leader, and I'll be telling them that Anta should be the one who we should be considering as Minister of Finance. But, you know, Anta, you know, as a brother, if you had known that I was going to be suggesting that you had this appointment, perhaps you would have given me the question in advance. Because it's a tough question. And, you know, fuel is money, and money is fuel. And I think your question basically reflects that. We just have insufficient funds to do the basic things that we have to do. And clearly, that means we have to do so many things and take so many decisions, which invariably always end up being cutting costs or retrenchment or doing things in certain areas which always inflicts the same pain on the ordinary suffering Ghanaian. Bernard asked me a very good question about taxation. Why are all these taxes there? Because government is lazy about how it is going to find this revenue, and therefore is shifting the burden onto those who are already overburdened. Anta, there's no magic bullet in this instance. But what I can say is that we would sit down with the various stakeholders to find areas where we can, and I think there will be a multiplicity of areas, it's not just going to be one area, where we can get certain amount of money to cover these kinds of costs, as well as see what we can do with the bulk oil storage operation that we have in existence to ensure that these kinds of issues don't crop up too often. But of course, you'll be the one solving the problem, so prepare.
Thank you very much. To remind our audience at home that this is a live coverage of the second IEA 2016 Evening Encounter, and our guest is the flag bearer of the CPP, Mr. Ivor Greenstreet, and we are here gathered asking him questions on his policy proposals. We will now take a question from the Executive Director of the EXLA Group, Daniel Osei-Tufo. Please make sure the mic is on.
Thank you very much, Bernard. Mr. Greenstreet, I would like to congratulate you on your presentation. That was great. This evening, I'll ask my question on unemployment. Even though you tackled on it with your agricultural model on the almond. Formerly, some few years back, when you complete senior high school and you get admission to the university, it becomes some sort of good news and joy for the family. But more or less, it's becoming hopeless in the sense that we have a number of graduates who are just at home without work. So now when people are about to complete school, they are I mean, the spirit of hopelessness dawns on them. And this is a serious issue, to the extent that nursing training, which was a safe haven for some ladies, has also joined the situation.
So please, what's the question?
Now, within the first 6 months of your term as the president of Ghana, should you win, what will be the pragmatic and practical solution to approach to remedy this situation?
Thank you very much.
Well, I mean, I'll try and keep my answer brief, and maybe I'll just restrict it, to dealing with nurses. Having been somebody who had a car accident and spent 1 year in hospital, nurses are my favorite people, because they are the ones who take care of you and look after you whilst you are there. And I think they even now currently have an issue where you have about 4,000 or 5,000 nurses who can't find employment because there is even a freeze on employment. And I believe one of the things that we will immediately do when we come into office is to ensure that we absorb all of those nurses into the system, both those who have been trained by government and those who have been trained privately. And we can do that using the CHIPS system, which currently has just one residential nurse there training community health volunteers. Instead of having the community health volunteers, we could find a way of pushing the nurses into the system, at least temporarily, to make sure all of those nurses get employment. But as far as graduates are concerned, I think I tried to indicate the nature of the problem I use an unfortunate expression, unemployable graduates.